Dr. Richards, who should get genetic testing for an inherited mutation for ovarian cancer, and how is it done?
That's a great question. I think that there are two populations that should be looked at for testing for for genetic inherited risk for ovarian cancer. The first one are patients that have strong family histories of breast and ovarian cancer. If we look at a family history for a patient and we see that they have multiple aunts and mothers, grandmothers, cousins of the first degree who have breast and ovarian cancer, those are women that we would want to test to see if they have carry with them an inherited genetic risk for ovarian and breast cancer. I mentioned BRCA1 and BRCA2 earlier. What we know about a woman who has a BRCA1 mutation is that they not only will have a strong family history of breast and ovarian cancer, but if they do have that inherited risk that has been passed down from their family, their lifetime risk of developing ovarian cancer if they're BRCA1 mutated is 40%, or up to 40% in some studies. We look at a BRCA2 mutation, which is a very similar mutation. We see that also has an elevated lifetime risk of ovarian cancer. In some studies, that's up to 25%. So those are very high risk patients. And so when we see a population or a group of, for a person who has a lot of family members with breast or ovarian cancer, I think that's one of the populations we would want to test for an inherited genetic risk for possible ovarian cancer. And the second one, I think that's really important, and with some of the emerging treatments that we've developed over the course of the last 5 to 6 years, is women who have a brand new diagnosis of ovarian cancer. Even if you don't have a strong family history of breast and ovarian cancer in your family and you are newly diagnosed with ovarian cancer, I feel that it's of utmost importance to try to test those women for a potential inherited genetic risk. And these are some, as we talked about earlier, something that may have been passed down from family members, what we call a germline mutation. In other words, that's something that I inherited from my mother that's been passed down to me, or potentially a somatic mutation, which is a mutation that develops within the cancer cells themselves. And both of those are very important things to be done. These are usually done through testing centers, usually through a genetic counselor. And I think genetic counselors are very important because they allow us to look at, to discuss with patients the potential role of the testing would have on them and what the potential benefit or risks associated with the testing are. And these are then done through either a blood or a saliva test that is sent off for evaluation for those patients. So I think that those are very important and things that we should do for both of those groups of patients whenever possible.